I just wanted to deal on that, and thank you, Kyle, for being on board. Well, I have one other person on the agenda, but I also have someone else in the audience who I know I would like to have to come up and speak. And Miss Cummings, okay, I'm not exactly sure what her new title is and all that, but I know she has one. But I've got to, we're friends. So I'm trying to really be nice because I am a little concerned about the issues that are going on with the health department. And, people have heard me complain that, we've made a bunch of phone calls to the health department, haven't gotten return calls, haven't gotten this, that, and the other. I don't know how we're going to change that around. But for me, it was a mortal sin to return my calls about issues concerning life and death in this community, and particularly around the COVID virus. We know we have a life and death issue with our homeless population, as well as with the opioid population, and now we have a pandemic. And all lines of communications has to be open all the time, and that's a lesson that I've learned already working with Danielle about how to go about doing this and keeping lines open so that we're all working together. Because it's not about you and I, it's about all these folk who live in this city, 105,000 of us. Okay?
Okay. Thank you, buddy. Thank you, buddy. So my name is Christine Arsenault Cunningham. So that's a new last name. So most people, Christine Arsenault, I worked in the mayor's office for the past 8 years, and now I am the administrative manager for the health department. So that was a new change just this year. So wanting to open up new avenues, work with the health department, and they're embarking on new programs like getting accredited, fully accredited. There's been a couple of different leaders over the years, and I really support and admire and respect Damone Chaplin, the new director, and was excited to learn some new things and embark helping that department getting on board with accreditation and what they're doing. So with COVID, this has hit all of us like a freight train, and it affects all of us in different ways. Our department, right from the get-go, has been embarking on managing the virus, and we get all the reports from St. Luke's and Hawthorne and the Community Health Center of all the positive cases. And from there, we started in our department with contact tracing before the state ever started doing it. So we implemented it immediately in the city and had our folks calling folks who were tested positive and asking them where they had been, who they had been in close contact with, defining that so people understood what close contact means. And then, of course, all of the orders that were developed between the Board of Health, the Director Damone, and the board and the mayor's office collectively to try to help. Everyone was calling our office with, what do I do? How do I do things? So kind of had to, on the fly, without much help from the state, kind of do best practices. And some of those best practices that we put into play are exactly what the state also put into play. Damone, our director, and the mayor talked to the state, talked to the governor's office. Damone talks with all of the other directors in the major cities across the state for best practices. So things, like our nursing homes. Obviously, we know that's where the most death has happened, is in the nursing homes because they're such a vulnerable population. So putting in procedures where those facilities were locked down to visitors, as hard as that was to say to everybody, including seeing my own father. But putting in those places, doing for some of the housing places like Olympia Towers, places like that, doing wellness checks, having the managers call these people every other day to make sure that they were okay. Some people live alone and don't have loved ones to check in on them. So we put those policies into place to help protect the community. So those are all just various things that have been going on. So where we stand, numbers sound bad. We stand just over 2,000 positive cases since this all began, roughly mid-March. So it's just over 2,000 positive cases, and there have been, as of today, 97 deaths. I can tell you because for a time when we were short-staffed in the office, I was actually processing burial permits. And as I looked through all the records, that anyone that died of COVID also had comorbidities. They had something else going on with them. So they were definitely more susceptible to the virus. And I can tell you that there are a lot of other people in the city, unfortunately, who are dying that have no COVID whatsoever. So, unfortunately, that's the numbers we're at. It could be worse. It would have been worse if the community hadn't responded. I really feel, and in conference calls that we have with other communities, that this community is doing what's right. The numbers are staying down, especially lately, only 3 new cases today, because everyone's practicing the social distancing. Seeking those, having your meetings outside, that you're not just saying, I can't have a meeting, I can have a meeting, but we're just gonna separate. We're all gonna wear our masks to keep each other safe out of respect for each other. This community has really stepped up with that. So that's a pleasure. I say to Buddy, he's my buddy, John Andrade, buddy to all, but you can call me in the office if you haven't had a response. You called, here I am. I'll do anything Buddy asks normally. So we'll work on whatever relations have been lacking. There's definitely been changes in this office with folks who had retired. So we're making changes in the office. That's why I wanted to be a part of it. So we're growing, we're moving forward, and we're here for the community. The health department's role, we have dentists in the schools. We have, our community nurses have been managing COVID, but a lot of it is opening up. All of our inspectors have been out trying to open up the restaurants to get them in business again, to have outdoor seating available in a healthy and safe manner. So those are all different departments within the health department.
I have a question. Anybody have a question can ask questions. This is the time to ask it. This is the health department. This is what's taking care of us during this pandemic situation. And so you have someone here who knows what's going on right now on the ground floor. I'm concerned that in this neighborhood that we've had some deaths. And I have not been clear and not been able to be clear about how the tracking of those individuals, who they've been in contact with, testing, cordoning off a section to make sure it's all been tested. And we have a neighbor, a street here has been inundated with the virus, and we could never get that information across to anybody. And then when we did, it became a whole lot of problems. What I would like to see for this neighborhood is that we have this beautiful property here, to be able to use it to put a tent here for testing.
I can work on that.
It's important that everybody get tested. I heard the governor say it, the mayor said it the other day. Everybody should get. I have not been tested yet.
Well,
and way back in March, I was concerned about my health. I made a bunch of phone calls to the doctors and all that stuff, and I'm still worried about my health. But testing is important, and we have the space here to do a pop-up tent here to have it done.
So that is something that we're actually working on right now with Cheryl Bartlett and the Community Health Center about trying to do. So in the beginning, there were not enough tests available. That's why you heard that unless you are displaying symptoms, if you had trouble breathing or had that dry cough, or if you had a high fever, you had to have some kind of symptom. The problem with testing just anyone is that if you test me today, it's going to take 2 or 3 days to get my results. I can catch it tomorrow and be positive by the time you give me my negative test results from today. So it can give you a false sense of security. That's why they didn't want to do blanket testing. Now, because they have found out that some folks are asymptomatic, so they're not displaying any of those symptoms, are positive, and they can spread it more easily to others. But now tests are available. So now there can be broader testing. And we are working about doing, so I will bring that back tomorrow and we will talk about doing something here.
And I want to
for
make
sure
sure that request comes from Danielle and I, and what work that we're doing here. Because it's important that we can't leave any stone unturned in trying to fight the virus.
Like I said, it's a false sense of security getting it tested when you're not feeling sick, but it gives us a baseline. And if you look at the charts that we've put up on the Facebook page of the tracking that we've been doing, we have the epidemiologist in our office that's doing some of this work. So we have some data showing that it's a much higher population in the Hispanic community, Latino community, and a lot of that comes from the fish houses. A lot of the employees working in those situations and their living situations tend to be in tighter quarters, and they're sharing rides to work. So we put in procedures for these fish houses and these manufacturing plants who are essential workers, so they've been working through it all to try to help, stem that and educate that population. So, yes, we'll definitely work on that. And another while, it's just because as I think things and we talk and then you forget things like, well, I'm going to say this when it's my chance, and I forget. But we've lost Derek. And did we lose Colleen? I was sitting with her.
Colleen, right there.
Oh, she moved. Yes. A very important thing to get more money for our community development block grants and to help them get in the places that they need to be, those funds, is our census. So everyone here, ask everyone you know and don't know, if you find them passing by, have you completed your census? It is very, very important that we get counted properly to get money to the city and for that money to trickle here. And part of that community, and I do believe that that information is available, can be available, and it should be looked at, and things can probably change. We need to raise the young leaders who are asking for it, because they can't give it to people who don't ask for it. So I'm 100% with everything that's been going on here. This has been a really good meeting, and I don't want to take up any more time because I know my stomach's been growling.
One more health issue. One more health issue. I want to bring everybody's attention to the porta potty in the field over there. See the green building?
Yeah.
We have 2 young people using it right now. Females. It took us a while to get it here, but once we got it, people started using it. And the key issue is that there is a problem. We have a problem with dogs, all badly, but we also have a problem with human beings having a place to go as well. And so we're very thankful to have this porta potty here in the neighborhood. And that's irregardless of the virus or the homeless issue or whatever. That porta potty plays a very important role. And I can tell you, 3 weeks ago, cutting the grass in here, we had human feces right inside the spot. So it's a big, very, very important thing. Because when we talk about the transitioning of the homeless and others, they're not all homeless, but they transit, they come right through here, all hours of day and night. Okay, and sometimes they gotta go, and no place to go. And over the last 4 months, everything's been closed. So where the hell do they go? And it's been a problem. And you can't fault them, because where do you go? The bars are closed, the stores are closed, the garage, where they normally would go, is closed. So this was a great achievement for us to get this here and put it here so that address another health issue in the community. Okay, so it's very important.